Myself, Vaheetha begum, pursuing fellowship in Strabismus management at Indian Academy of Optometry. Strabismus or a squint is a misalignment of an eye. In other words, eyes do not line up with one another. There are several forms of strabismus based on direction, esotropia, inward deviation of an eye, exotropia, outward deviation of an eye, hypotropia, downward deviation of an eye, hypertropia, upward deviation of an eye. The term tropia mentioned suffixed to those words denote that the squint is manifest, that is, the deviation of an eye seen with no occlusion of either eye. The term phoria denotes that the squint is latent, that is, deviation of an eye seen only when the binocular fusion is interrupted. Based on committance, it is incommittant and uncomittant. Incommittant means angle of deviation present in primary gaze is not same in secondary gaze. That is, there is a change of deviation depending on the direction of a gaze. Whereas in concomitant, deviation seen in primary gaze is same or unaltered in all the secondary gazes. Now, I proceed with my practical paper on identifying strabismus based on direction, committance, corneal reflex, and cover test. Corneal reflex test, which is also known as Hirschberg test, a simple procedure to roughly estimate the amount of deviation present by shining the light of a torch on a patient's forehead at the distance of 2 feet and observe the reflex seen in the cornea. If the reflex seen in the cornea is center of the pupil, indicates presence of no deviation. 1 mm of decentration gives approximately 7 degree of deviation. If reflex is seen at pupillary margin, approximately 15 degree of deviation may present. When the reflex is at mid-iris, up to 30 degree of deviation present. At limbus region, approximately 45 degree of deviation is present. Here, the patient has corneal reflex at limbus region, so approximately 45 degree of deviation is present, which requires 90 prism diopters. In direct cover test, by covering the deviating eye, which is left eye, and observe the other eye, there is no deviation of eye present in uncovered eye. Then covering the right eye, which is non-deviating eye, and observe the movement of uncovered eye. Since the patient has exotropia, the eye moves nasally and takes up central fixation. In cover-uncover test, we can conclude that there is no presence of latent deviation in right eye, that is, absence of phoria.